الأعزاء، محاضرتنا اليوم حول مضادات الهستامين or what is called antihistamine. Before talking about antihistamine, we have to know a little bit about histamine as a mediator. So histamine basically a chemical messenger generated in mast cell. Histamine is responsible for many of inflammation and allergic reaction. It's also have a role in gastric acid secretion and as neurotransmitter in part of the brain. So that's to say, is histamine released almost in all tissues. According to the previous slide, we will assume that histamine is present in all tissue. However, its amount might be differ significantly from lung to GIT to blood vessels and so on. The highest amount of histamine can be found on mast cell and basophil. It's found also on brain through H3 receptors and can be found as a basic compound of venoms and on the secretion from insect sting. How histamine can be synthesized? So histamine basically formed by decarboxylation of histidine by histidine decarboxylase. So through by this reaction, so histamine will be released or formed. Generally, histamine can be stored in granules, but if not stored, this will be inactivated rapidly. How this could be by the enzyme called amine oxidase. And later on, we'll talk about this when we about in response to allergic reaction and anaphylactic reactions. How it works or mechanism of action. As I mentioned previously, histamine is present in almost in all tissues, and it exerts its effect through specific receptors. For histamine, we have H1, H2, H3, and H4 receptors. To exert its effect, histamine must bind to one of its receptors to exert its effect. For example, for H1 receptor to induce some effect, for H2 to participate in gastric acid secretion, and so on. The most important receptors we're gonna talk or clinically important are H1 and H2 receptors. Why? Because most of the drugs are antihistamine belong of these two subtypes. Most of H1 receptors are used to treat different conditions, ranging from allergic reaction and can be used as somnification. And for H2 receptors to neutralize and FS. H1 receptors are basically important to produce smooth muscle contraction and increase capillary permeability. And vice versa. This will be applied for H1 blocker because it will antagonize the H1 effect. So histamine promote or facilitate vasodilation of small blood vessels, causing uh, the endothelium to release nitric oxide. It also enhances the secretion of pro-inflammatory cytokines in several cell types and the local tissues. Through H1, this will trigger or mediate the response to allergic rhinitis, atopic dermatitis, conjunctivitis, urticaria, bronchoconstriction, asthma, and anaphylaxis. This is all mediated through H1 receptors. Histamine also stimulates the parietal cell in stomach, leading to an increase in acid secretion through H2 receptors. However, we're not going to talk about H2 receptor here. Our lecture today will cover only the H1 receptors blockers. Then histamine will cause contraction of airway smooth muscle, stimulate the secretion, dilation, and increase permeability of capillaries and stimulation of sensory nerve ending. This will be responsible for pain and itching and in the maybe second or third slide, I mentioned that histamine usually is stored in granules. However, it's not stored, will be deactivated. And this, if it is released slow enough, this will trigger or result in allergic reaction. However, if histamine release is too fast, that means inactivation will take time. In that case, the anaphylactic reaction will occur. And this depends on the strength of the stimuli and how the body responds to it. So this figure basically shows how H1 receptors are mediated the exocrine excretion, bronchial smooth muscle contraction, and intestinal smooth muscle, sensory nerve ending. And it's also its effect on cardiovascular system, on effect and on stomach, which is mediated by H2 receptors, but all the effect which I mentioned here, just repetition to the previous slides, this mediated through the H1 receptors. And I do believe any of you, if you never get a scratch, he will see a redness on his arm, maybe, or hand, or whenever. This is through peripheral receptors for H1, which resulted in what we call trigger response for histamine release. So histamine triggers what we can do. We need to block or antagonize its effects. I don't think any of you or any of us he will like to have itching and pain on his hand, or will have like sneezing or rhinorrhea during the hay, if he got hay fever during the seasonal and so on. So we need to antagonize the effect of histamine. Basically now through the blockade of H1 receptors. From its name, so H1 receptors will block only or antagonize the effect of histamine through H1 receptors only. It has no effect on H2 receptors because H2 receptors found on stomach, so we're not going to talk about this. It's all about antagonize the H1 effects. H1 antagonism or H1 blockers classified in two main groups. We have first generation drugs and second generation drugs. This is a general classification. From first generation drugs, we have several drugs like carbenoxamine, diphenhydramine, hydroxyazine, cyclazine, and other drugs. So what characterizes these drugs? The first generation antihistamine, they can penetrate the central nervous system, causing sedation. It can also interact with other receptors and produce unwanted adverse effects. For second generation, we have terfenadine, estimazole, fexofenadine, loratadine, strazine, and others. If we want to compare the second generation to third generation, we can see that they don't penetrate the blood-brain barrier, so they are not entering the central nervous system. That is to say, they not cause any depression compared to the first generation. And this is of advantage. For example, as a student or me as a teacher, if I have hay fever, I don't like to have hydramine or phenylephrine, for example. Why? Because I want to be awake and alert. Instead of that, I can safely take loratadine. It's long-acting with less sedation. But if you say I can have strazine, I say they might have a little sedation, so be away from that because you can have another antihistamine will give you the same effects with favorable effects. So this figure basically compare between first generation antihistamine and second generation antihistamine and shows the first generation who produce sedation. Why? Because they enter cross blood-brain barrier and enter into CNS, causing depression. Several of these drugs can be used to treat motion sickness. So some people, when they cannot tolerate travel by car or ship sometimes, so due to the stimulation of this nervous system, so we need to overcome and counteract this effect by giving medication that prevent the nausea and vomiting. For second generation, we can see here, for example, desoratidine, levetiracetam, and loratadine. They are non-sedating. But we have activacin and citizine and levetiracetam. They are of few less sedative effects compared to first generation. For what reason we can use H1 blocker? As they trigger allergic reaction, so we can use them in allergic and inflammatory condition. We also can use them to counteract the motion sickness and nausea. And they can be used as somnifying agents. Why? Because of their sedative effects. So this is the main indication for H1 blockers. In this slide, it basically shows the action of histamine blockers, the H1 blockers. So they decrease inflammation, itching, sneezing, and rhinorrhea. That's why they are useful in allergic inflammation. They decrease the neurotransmission in the brain or central nervous system, causing sedation, and they increase appetite. Particularly, we have cyproheptadine, which work on serotonin. As I mentioned, another unwanted effect of particular interest for promethazine through alpha-adrenergic, causing hypotension, dizziness, and reflex tachycardia. One of the unwanted effects through cholinergic receptors will cause dry mouth, irritation, and sinus tachycardia. Especially alarmine or diphenhydramine and promethazine. Yes, we are in need for H blocker and we want their effect, but we need to bring special attention or be aware of some unwanted effects, especially we are looking for interaction. For allergic and inflammatory condition, so they are useful in treating and preventing allergic reaction caused by antigen octin and immunoglobulin epsilon antibody, which is triggered by inflammatory response. Generally, oral antihistamine are good at controlling all symptoms, ranging from allergic rhinitis, urticaria, through the peripheral receptors due to release of histamine by mast cells. Some antihistamine are useful to treat allergic conjunctivitis, locally. We also mentioned antihistamine can be used to treat motion sickness and nausea. Diphenhydramine, dimenhydrinate, diclazine, meclazine, and promethazine are as effective as in prevention the symptom of motion sickness. However, these drugs is not effective if the symptoms already started. Let's say if you are in a picnic or you traveling from one city to another and the symptom already started, you start vomit. In that case, these drugs are not good enough because we can use them to prevent the occurrence or the stimulation of vestibular so will not vomit. Usually antihistamine like seclazine or meclazine can be administered at least 15 minutes before trip. Basically because they prevent nausea and vomiting mediated via chemoreceptor and vestibular pathway. And it's also associated with the blockage of H1 receptor centrally and muscarinic receptors. From these drugs or from this agent, meclazine is very good to treat vertigo. We mentioned that antihistamine can cause depression of CNS, and as a side effect, they can cause sedation. That's why they are good to be used as sleeping aid. For example, diphenhydramine, doxylamine, they can be used here. These drugs generally over the counter. And as I mentioned earlier, antihistamine, specifically first generation antihistamine, cannot be taken for specific people. If you are students, if you are worker and your work require alertness, or if you are driving, for example, from home to work, in that case, you need to avoid third generation antihistamine. Even though you don't have a choice, just you need to give up the third generation. You need to compensate or use an alternative, the second generation drugs. However, the second generation, as we mentioned, we have loratadine with no sedation, long-acting, compared to others. What about absorption? Generally, antihistamine, they're very good or They have well absorbed after oral administration. Serum level can reach its maximum after 1 to 2 hours. The average plasma half-life in blood will be 6 hours, with the exception of second generation antihistamine like loratadine might reach 24 hours. Again, H1 antagonists distributed in all tissues, including CNS, causing depression. They are mostly metabolized by liver enzyme, specifically CYP450 system. And this might result in drug interaction with some drugs like ketoconazole, which is antifungal, or macrolide antibiotics. And it's found that grapefruit juice is also inhibit CYP1 enzyme, increasing the blood level. Strazine and levothyroxine, they are secreted and changed in urine. However, fexofenadine largely unchanged in feces, and some offer antihistamine are available as ophthalmic or intranasal formulation to produce their local effects. For example, in allergic in hay fever or allergic rhinitis or conjunctivitis. So what's the most common side effect or adverse effect can be seen generally with H1 blocker? Sedation, specifically for third generation. Alarmine or diphenhydramine may cause paradoxal hyperactivity in young children, so should be used in constant with the physician. It also causes fatigue, dizziness, and sometimes tremor. They can cause dry mouth, blurred vision, and retention of urine. And this action through interaction with cholinergic receptors. Headache can be seen with second generation antihistamines. Some topical medication can cause hypersensitivity. Increased appetite, it also can be seen through stimulation of serotonin, specifically cyproheptadine. this mostly seen side effects. For drug interaction, since we mentioned most H1 blockers, specifically the first generation, they enter the central nervous system causing depression. That's why we will ultimately expect consumption of alcohol and another CNS depressant. It will have additive effect or synergistic effect. Also, patient who takes monoamine oxidase inhibitors cannot take antihistamine due to the effect. And concomitant use with anticholinergic might decrease the effects of choline inhibitors. I also mentioned earlier it could be interaction with ketoconazole antifungal or with microrelease antibiotics through the inhibition of the CYP3A enzyme, leading to increase its effects. Generally, antihistamines are well tolerated with what's called high margin of safety. However, toxicity might occur or might be seen in children. The most common side effects will be through the CNS, including hallucination, excitement, ataxia, and convulsion. With this, we reach the end of our lecture.